Which brings us to Chris Sununu, the former governor of the state of New Hampshire, who joins us now. Good to see you, Governor, as always. You start there, or you could just take it wherever you want. On anything kind of surprise you with Kennedy today? I think we knew a lot of this was going to happen. I still don't think we know exactly how the vote's going to come down. Your view?
Yeah, so I can't tell you exactly what the vote's going to come down. My sense is that he's going to get there by 1 or 2 votes. But look, if you want to see what Washington is all about, kind of the wackiness and craziness, go back and watch this hearing. Yeah, the bizarre part about it, and I appreciate people's passion on the vaccines and his contradictory statements that he's made in the past. He tried to clarify some of that. But when it comes to healthcare and HHS in America, it's accessibility and cost.
Yep.
And that was almost not even touched in this hearing.
Well, I thought
which is
Cassidy
shocking.
tried.
It's
I thought Cassidy tried, and he's a big vote on this, right? So, and you talk about not being. Now, in fairness, I don't know how specific Kennedy's answers were there. Like he was going after him on Medicaid, not after him, but he was saying, "Hey, what are you going to do with Medicaid, for example?" And Kennedy talked around it a little bit, right? And those are serious questions. Senator Cassidy, by the way, is a doctor, but go ahead.
Yeah, no, and you're hitting it right on the head, because what I got from this is some of the shakiness on his lack of understanding. I mean, he understands how Medicaid and Medicare work fundamentally, but he really has no plan and idea how to go about reshaping it and creating more opportunity. And I think that's the low-hanging fruit, right? There are effectively monopolies within the healthcare system that are driving up costs, delivering a bad quality of care. I mean, dialysis alone in this country is basically a duopoly between two companies that control all the money, control bad service, and don't want new technologies to come to bear. The one thing Kennedy is undoubtedly going to do with HHS is pull back the curtain and expose a lot of this and break some of this old school thinking about healthcare with the goal of trying to get better access and cost. But it really wasn't touched upon, and he's got his homework to do. And, there's going to be another hearing tomorrow. That'll be pretty interesting to see where that goes. Yep. I think that will touch a little more on this. And let's not forget Dr. Oz, right? I can't believe we're saying this in this conversation.
Who would, right?
Bizarre world.
Yeah.
Yeah, but he's going to be the head of CMS. CMS is the Center of Medicaid and Medicare Services, one of the more complex appointments that the president makes. My concern is that do they really understand the immense complexity and nuance of those programs? Because that's what really is driving healthcare costs in this country. That's what drives accessibility. I want to hear more of that kind of stuff, because why are we even talking about RFK? I mean, to have Ron Johnson defending the Kennedys right now, I mean, a wholly bizarro world.
It is bizarro world. It is bizarro world. But there's an appeal, I think, in some ways, because the concern about him is very well documented. The vaccines and everything that we've talked about over and over again. I think the appeal is the stat we brought up earlier in the show. Is that everyone looks at this and they say, and I'll read it again: healthcare spending per capita in the United States, $12,742. It's like almost twice the average of the other wealthy countries, but then the life expectancy with the U.S. doesn't compare well at all with those other countries. It's the lowest, or one of the lowest, right? No. So people say, all right, let's try something new. But again, to go back to the earlier question, it's the what, it's the how, it's the execution, and whether this is the right guy for it.
And unfortunately, the Democrats have no moral high ground to stand on here, because tell me one thing that the last HHS secretary for President Biden, what did they do to lower costs? What did they do to create more accountability, set a better standard, right? Virtually nothing. So the Democrats had their shot at it, and they did nothing for America. And this is the #1 issue facing American families, and our debt, and it's just such a national issue. So the fact that you're going to get someone in, I'm cautiously optimistic he's going to be hopefully a positive disruptor of a system that needs massive disruption in Washington.
And you think he'll be confirmed. Another issue today. Thanks so much for watching. Just go to joinnn.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.